Hi, it's Dr. Herman again, and you've seen some other videos from me about your neuropathy condition. The reason why you're getting this video now is because you had registered your email, your name, your information on my website called browardneuropathy.com. And you saw a video about me talking about different types of metabolic testing that I do that helps us understand some of the causes, how we investigate, and offer you some unique assessment and unique treatments to be able to help you get well from your neuropathy condition. And what I want to do in this video is help you understand that there's only 4 things that can cause your neuropathy, or there's 4 categories that can cause your neuropathy. And by the end of this video, hopefully you understand that you could be one or more of these 1 categories that we need to assess and help you get well. You can get well. First category of neuropathy is you could have a pinched nerve. Pinched nerves are pretty common, and we've heard that before from doctors for decades now that, oh, it's the pinched nerve. Oh, he has a pinched nerve. Well, there are, through my studies in electrodiagnostic studies, when you run a nerve test, when you send electrical impulse down a nerve, there are ways to check, and you probably have already had one of those done by the time you're seeing this video. You've already been to a neurologist or a hospital. Has that nerve been trapped going down the arm by the elbow, or is there a muscle bundle or a carpal tunnel problem that hits just one finger, or is it hitting just one toe in the foot? That would be a pinched nerve scenario. I just feel it in one part of my hand here. You can have, in the next category, a problem that happens where there's a lesion from arthritis or from a disc herniation on your spinal cord. So if we do have from spinal cord involvement of a fracture or a herniation, it can occur where there's material that has now compressed, squeezing down on the nerve roots. That can cause pain to go down the whole arm or leg, or it can come from, again, the compression fracture if somebody fell off a ladder or something like that, some severe trauma. But most likely you've already been through the hospital and someone and had casting and whatever type of repair to the spine. And you may still be dealing with pain. So now we have to go to the next level. So again, we talked about pinched nerve, and that can be relieved with the therapy I offer here. But if you've already gone through care, to the chiropractor or the physical therapist, or had a shot or a pill, and you're still dealing with the problem, it may not be a pinched nerve, even though you've been told that. But if you were told that, and that was the answer, or the reason, you should have been relieved with the kind of care that you've been offered already, most likely. Second, with the spinal cord, if it is a fully blown disc herniation on the spine, there are ways to help that as well. I mean, you can try surgery, which has a 50-50 opportunity, is what the doctors may tell you. The success rate is maybe a little bit less than that, but depending on which physician you get, if you're lucky. And some doctors are better than others, of course. But there's also decompression. There's ways that we can actually stretch that spine and help the disc resolve and take away the pressure from the spinal cord of the nerves, if that's causing your pain. Most often patients have already gone through that type of care before they come to meet me for their neuropathy, and they're still dealing with these pains or the numbness or the tingling in both legs and feet. So we've got to get to the next category. The next category is metabolic conditions. Metabolic conditions, in my studies of functional blood chemistry analysis, functional endocrinology, functional immunology, gastrointestinal disorders, thyroid conditions, and immunology, we've got to understand that there are multiple reasons that can cause a metabolic change or a shift in the way that your body's chemistry is working that can cause weakness of the legs, that can cause numbness and tingling in your legs and feet, or burning, or pins and needles. So when we talk about metabolic conditions, we've got to look at a full blood chemistry analysis, because you could have anemia. Anemia, whether it's iron or B vitamin anemia, may not allow your blood to be bringing oxygen to the brain properly and oxygenating the nerves properly, because if your nerves don't get oxygen, they're not going to feel well. And one of the findings I'll notice in a patient where they don't have good oxygen supply is they may have pins and needles in their legs and feet. It always feels like a foot fell asleep. And I may notice that their nails on their toes look like fungal nails, and or they're just yellowish looking. They don't have a good, nice, pink, perfect blood supply to the nail bed of the toes. And that's a big problem. And we've got to be able to make changes with that. So we've got to look at your blood to see if there's an anemia pattern, whether it's B or iron anemias. But other things can cause the pins and needles, not just the anemia, but that's one thing. The next thing metabolic-wise, we've got to look at, do you have an immune reaction that's taken place? Immune cells can get inflamed, and those immune cells can attack your nerves. Now, some patients have come to me where their doctors have run multiple sclerosis spinal taps on them. They've run lupus studies, or rheumatologists have run rheumatoid arthritis antibodies. They've run specific tests to look for specific diseases in the body, and they've fallen short. And what we've got to understand is to go further down the hole of the immune system and see, have there been other types of antibodies from diet and so on that can form and start attacking different cells? The cells of the body may be under attack by your immune system, and it may not be a rheumatoid or a lupus or an MS. There's different ways to look at this. You can even have an immune cell attacking on your brain. That doesn't let your brain tell your foot how to feel. That's a possibility, and that's not cancer. That's something else. So we've got to look at specific immune cells and see if there is immune inflammation in the body. Another metabolic condition that we find here is that people have reactions to certain foods that they eat. They're sensitive to their foods. If you're eating foods that you think is okay because the food and the drug, what is it, the food pyramid says that it's okay for you, but without you realizing that you may have an immune response every time you put food into your system, and that food, like maybe milk, doesn't do your body good. Or maybe Wheaties is not your breakfast of you being a champion. Or Cheerios might not be good for you, or something to that matter. And I find on patients when I run specific blood and stool tests that I've mentioned in the first neuropathy video, I find that patients have sensitivities to their foods. And it's incredible because these foods are causing immune reactions where the immune system starts turning on their body tissue and eating away at the nerves. And that's serious. Your own body might be attacking your nerves, and it won't be the rheumatoid arthritis or MS type of neuropathy condition. So we've got to be able to look for those things. Metabolically speaking, you may have blood sugars that are just a little bit out of order. You go to your doctor and he or she runs a blood lab on you and sees that you have a blood sugar level that's 110 and your triglycerides are a little high, and hey, it's okay, don't worry about it, John, and you just eat right and we'll check you in another 6 months. Or maybe you really do have diabetes where it's above a certain number on that blood lab, and you're taking diabetic medication and you're still feeling the neuropathy in your feet. We've got to understand, we've got to look at a very narrow functional range for your blood sugars and triglycerides, and make sure that everything that's feeding your brain, because sugar, glucose, is one of the fuels that makes your brain run. And if it's a little low or a little bit high out of order, like pre-diabetes, your brain won't function normally. It's impossible. And that alone can cause neuropathy. I have found in patients when I do a good blood test that their gallbladder, either it's been removed, or they've had gallstone attacks, or maybe the gallbladder is just a little bit out of normal function. That may cause burning in the feet. That's a possibility. So we've got to assess that gallbladder and make sure it's okay or not. There are some people who come in here who have oxidative stress on their system. Their liver's not doing the job to calm down and filter and detoxify the system. Your liver has to be tested. Specific liver detoxification studies are available to us. Metabolic changes can occur where your nerves are not getting the proper oxygen supply that they need. When your cardiovascular system, from peripheral arterial disease that has to be checked for and can be helped, from a stroke, from a mini stroke, from a number of brain stresses that you'll see in another video with me, when your brain and someone is not able to control the diameter of the blood vessel, and your blood vessel that runs through the nerve, like threading a needle, it does. When it runs through that nerve, if that artery is, instead of it being nice and wide and carrying blood and oxygen, if it's constricted, and gets really, really, really constricted, and there's maybe only 30% of the blood and oxygen flow going through that nerve, do you think your nerve is going to work normally, or is it going to work abnormally? It's going to be abnormal. You may get pins and needles, you may get numbness, and your doctor has you on high blood pressure medication. And then here's the next scenario. Maybe you have cholesterol medications and you're on because you're worried about your high cholesterol, or your doctor put you on that. You've got to understand, one of the side effects of cholesterol medications, of the statin medications, is neuropathy, is leg and foot pain. So if you have these pains, we've got to look at the chemistries of the body. We've got to look for any metabolic concerns that may be a little out of order that can be shifting your body's function and making you feel an abnormal stress like numbness, tingling, burning in the feet, or sensitive skin. Okay, so we talked about the pinched nerve. One of the categories it might be. We talked about the spine, if there's a trauma against the spine. We've just talked about multiple metabolic concerns. So that's number 3. And number 4 is the human brain. Understand something about your brain. You have different parts of your brain that control different things. If your foot is not feeling normal and the roots of that sensory and of the foot starts here in the brain, if that foot's not working normal, can you at least fathom that it's possible that your brain may not be doing its job? Listen, you may be smart, you may work 9 to 5 or have your own business, you may make a lot of money, you maybe are not making a lot of money, you may have friends, and you may go out and play guitar or go bowling and do all these different things, and you're functional and you live your life and you have kids and grandkids or so on, or you have all your wits about you, but maybe parts of the brain that control those parts of your body, like your feet and your hands, are just not doing what they're supposed to do. We have to assess that. You've got to understand something else. You have a right and left hemisphere of the brain that we'll talk about in another video. But if your right brain gets a little weaker than your left brain, and this happens to people, what if that left brain that controls the right body is working at 100%, but the right brain that controls the left body is only working at 70% or 80%? Do you think that the left body is going to work normal if the right brain is not doing the job properly? It can happen, and it does happen, and that's what we have to assess. So what I want to get through to you in this video about your neuropathy condition is, yes, there could be a pinched nerve. That's one case. 2, it can be where you have a spinal cord trauma. 3, there's metabolic conditions. And if your doctor said, well, you're not diabetic and you still have neuropathy and we just don't know why, like I've heard some people tell me, even friends of my family, friends of my parents have told me. I went to the doctor and they said, you're not diabetic. I don't know why you have neuropathy. Well, there are reasons for that. We've got to look at all the metabolic concerns. And number 4 is look at the human brain and see if the brain is doing its job. And we can change that brain function. That's what I do in functional neurology, to change your brain's function and calm down the metabolic stresses, change your lifestyle and diet, give you specific supplements, and you can overcome your neuropathy and be well. Listen, there's an answer, and there are unique treatments that we have to offer you here. I look forward to meeting you. If you want to go back and watch that video about the different tests that I run, it's at browardneuropathy.com. My office number is 954-370-3100. I'm a doctor who understands your system. I'm a doctor who cares, and I can help you get well. I look forward to meeting you. Thank you for your time.